CHI Health gets a $500,000 grant to help grow its peer specialist program.
They'll hire more staff and expand service areas.
KETV News Watch 7's Cal Larson talked with one man who says the program changed his life. Cal joins us live.
Julie, Bill, leaders at CHI say the grant is a show of faith that the work they're doing is making an impact. As for people already part of the program, they say it's like finding their calling.
Because I have been where they've been, it's easier for them to talk to me about certain things.
Ken Timmerman is 64 years old. He's a peer specialist at CHI Health Emmanuel, serving in the Geriatric Behavioral Health Unit.
I learned that I'm more capable than I thought.
Ken has a variety of mental health diagnoses, including OCD, PTSD, and generalized anxiety. As a peer specialist, he's learned no one is limited in their ability.
You can reach your highest potential no matter what that potential is. And many times when you reach this potential, you find out you have this potential.
Robin Conyers is the Division Vice President of Behavioral Services at CHI Health. She's been a part of the Peer Specialist program since 2008. They have 5 peer specialists and plan to hire 10 more.
Sky's the limit as far as the programs that could be offered or where they could be placed and how they can enhance that care, for sure.
Peer specialists work with patients with mental health or substance abuse diagnoses. They exist to show patients that there's light on the other side.
It's really a non-intrusive way of just someone saying, I'm here to listen, and I'm not going to judge, and I'm not going to tell you what to do or what you should do. I'll share my story, and I'll provide you options, but most importantly, I'll listen.
Conyers says the benefit of peer specialists is the experiences they bring, like Timmerman, who has one simple message.
I would say you have something to share. I would say it doesn't matter what people think. It matters what you have to give.
Conyers says this program is something that should and could be replicated at hospitals across the nation. She adds that because of their experiences, those peer specialists are able to connect with patients and have conversations that other hospital staff just can't. We're live at CHI Health Emmanuel tonight. Cal Larson, KETV News Watch 7.